Hospital and county health officials in Springfield, Missouri tonight announcing hospitals in Springfield are full. The tide of COVID patients is still only increasing. They are asking the state to come in and open an alternate care facility, presumably some kind of emergency field hospital in Springfield, Missouri, because the ICUs are full, the ventilators are maxed out, the staff is maxed out, the beds there are at capacity. Again, this is now. We've been watching over the last couple of weeks as hospitals in southwest Missouri have been sounding this alarm, announcing that they were hitting new records, opening new COVID units, making public appeals for respiratory therapists to come from other parts of the country to come help in Springfield, Missouri. It's just a bad combination there right now. This aggressively contagious Delta variant finding very fertile territory in Missouri's largely unvaccinated population. In southwest Missouri, no county has more than 35% of its population vaccinated. And if you widen the lens a little bit beyond just Springfield, the situation actually looks a little rougher. Just outside Springfield, Missouri, to the southeast, is a small rural county called Howell County. There's no good-sized cities there. It's a rural place, very white, very conservative. As far as I can tell, that county made national news precisely once in the past 15 years. In 2008, when somebody put up a racist billboard of then presidential candidate Barack Obama wearing a turban. That county, not surprisingly, very conservative, rural southern Missouri in the Ozarks down near the Arkansas border. They've got particularly low rates of vaccination there. And in Howell County, they don't have a lot of health infrastructure. It's just not that big a place. And if you get really sick in Howell County, Missouri, what they do is they send you to Springfield. It's about an hour and a half, 2 hours away. But again, in Springfield right now, they're full. In Springfield, they're begging the state to set up some new pop-up emergency hospital. And please, they need it within days. They can't wait weeks. It needs to happen now. And it's one thing to see that desperation in the city of Springfield as their COVID numbers go through the roof. It's another thing to realize that all the less populated counties and communities, the less resourced counties and communities in that whole part of the state, they were all counting on being able to send their folks to Springfield when the virus started ripping through those largely unvaccinated communities as well. What do you do if you're in that situation? A few days ago, a viewer from Missouri sent us a public plea that had just been posted on Facebook by Ozarks Healthcare in Howell County, begging people in the county to be vaccinated, but also showing understanding that people don't want to do it, or at least that they're worried about being seen doing it. And so in Howell County, Missouri, the big-hearted, quick-thinking health authorities there have come up with something. They are now offering discreet vaccine appointments. They're making it possible, basically, for people to get vaccinated in secret. They posted on Facebook, quote, we understand getting vaccinated is a personal choice. Choosing to get vaccinated has been put in a strange light. For some, getting a vaccine may mean losing friendships, but it is a choice that can impact so many lives other than your own. If you have questions about the vaccine, any questions, we're here to answer them. If you need to schedule your vaccine, we are here to help. And then get this. If you are afraid of walking into a public area where you might be seen getting your vaccine, we will work to accommodate even more of a private setting for you to receive your vaccine. Howell County, Missouri. That post was then shared by the local county health department. It is desperate in that part of the country right now. And if it means people need secret private vaccine appointments to get vaccinated with nobody knowing that's what they're doing, local health authorities will now do that for you. But widening the aperture on this story sort of gets you to each new story here, right? Crisis in southwest Missouri and Springfield, where the hospitals are now being overrun. They're at capacity with the numbers still spiking. Crisis in all of southern Missouri as the virus runs rampant there, and there's nowhere to ship patients, in part because Springfield has no room at the inn. Widen the aperture a little further. This is the headline in the Kansas City Star yesterday. Vaccination rates in some Kansas City area counties lower than in hard-hit Springfield. So yeah, southwest Missouri, Springfield's in crisis, coping with this rabid Delta variant that infects unvaccinated people so easily. But head up the highway to Kansas City, Missouri, triple the size of Springfield in the city itself. The Kansas City metro area has 2.1 million people. They've got vaccination rates in many parts of that metro area that are even lower than what they've got in Springfield, which is the city that is already overrun and begging for help. Right? And hey, Kansas City, here comes Delta. If you want to travel to Chicago from Missouri or Arkansas, and you are unvaccinated, the city of Chicago now says, as of yesterday, you must quarantine for 10 days or have a negative COVID-19 test, again, as a condition of your travel to Chicago. I mean, but just keep widening the lens, right? If we have learned anything in this miserable pandemic, it is that viral dynamics do not care about human labels and borders. Unless you suppress the virus everywhere, people are vulnerable anywhere. We recently stopped using geographic labels for different variants of the coronavirus, but the Delta variant that is wreaking such havoc right now, it first emerged in India, right? With their raging wildfire of an outbreak. And it may have been easy for Americans to see what was going on in India as a sort of sad, far away foreign story. But now that variant, born in India, is the one that is ripping through the Ozarks and southwest Missouri. And it's not like West Plains, Missouri and Howell County is a big hub for international travel from India. It's just that this is a global pandemic. It doesn't go away anywhere until it goes away everywhere. And the only way it goes away is by getting people the vaccine. And as this thing rips through more unvaccinated populations, it produces more and more deadly variants that then spread to every corner of the globe. If you widen the lens all the way out, throw it all the way open, it is clear that it is not just this sort of poetic pie-in-the-sky notion that humanity needs to all pull together at times like this. It is self-interest for every community and every country, no matter how far away those other places might seem or whether or not we are friends. It is self-interest for every community and every country to suppress this thing everywhere, which means vaccines everywhere.